Come in.
Hello, my name's Emily. I'm going to be your nurse today. How are you feeling?
I'm feeling good.
Good. All right. Well, I'm going to do your admission assessment, ask you a couple questions, get to know you better, and take your vitals. That's what I do.
Okay. Sounds good.
And I would wash my hands and provide privacy. And then I would also ask for her name and date of birth just to make sure she is the right patient. So, can I get your name and date of birth?
Janine Haig, 12/21/61.
Okay, and I touched her wrist there, and her skin felt moist. Well, not moist, it felt dry, normal. And her overall appearance is good. She seems calm. She is cooperative with commands. So, okay, so we're gonna ask a couple questions now. So, Miss Haig, do you know why you're here today?
Yes, checkup.
The checkup, okay. And who's the President of the United States?
Trump.
Trump, okay. Do you have any past histories of diabetes, hypertension, any pulmonary issues we should know about?
No.
No, okay. Do you smoke or drink alcohol?
No.
No, okay. Do you take any prescription medications?
No.
No, any over-the-counter medications, Advil, aspirin?
Nope.
No, okay. All right. So, have you fallen recently at all? Have any
No.
injuries? No
No.
injuries. Do you use any devices at home to assist you with your mobility?
No.
No. So you're a pretty independent person. Okay. Do you live alone?
No.
Okay.
Married.
You're married, so you live with your husband. Do you feel pretty safe
Yes.
at home? Okay. Do you struggle with any depression or any anxieties of any kind?
No.
So no recent mood changes?
No.
Okay. Okay, well, I think I will take your blood pressure now. I'm going to take your vitals. I'm going to take her temperature, her pulse ox reading, which is her oxygen level, and her respiratory rate, and her radial pulses. So I don't have a blood pressure cuff, but I would ask which arm is okay to use. If she's a dialysis patient, I would keep that in mind as well. And if her blood pressure was above 130, it would be considered hypertension. 130 is considered pre-hypertension, but so blood pressure is good. It was 120/80.
Oh, good.
Okay, and then I would take her radial pulse here, and I would take this for 30 seconds or 60 seconds, 30 times 2, and then I would also take her respiration rate as I'm taking her pulse. Okay, it was 64, so that's good. It's very good. And then I would also check her brachial pulses to make sure those are equal on both sides. I would check her radial. So I would feel here, and those are 2+. And I would check her brachial. And those are 2+ as well. And then Miss Haig, can you squeeze my hands for me? And this is to make sure both sides are have the same strength. And then we would check skin turgor and make sure there's no tenting of any kind. And there's not. We would also check cap refill. Anything under 3 seconds is a good. There we go. That's good. And now I'm going to check your eyes, make sure they are equal, round, and reactive. So I'm going to have you stare at an object in the distance.
Yes.
And don't move your head, just stare at the object.
Okay.
And I'm just going to shine this in your eye. Right. Okay. Very good. And I'm going to check your accommodation, so I'm going to have you stare at the tip of this as I move it. Don't move your head at all. Okay. Okay, looks good. So her pupils are equal round, reactive to light, and they are accommodating. So we've done the eyes, we've done the pulses on the upper body, and we've done her vitals. Her vitals look pretty good. Her pulse ox, if it was a 90, we'd be a little bit concerned, but if she was a COPD patient, that would be considered normal. So now I'm going to take your, listen to your heart sounds.
Okay.
So, oh, I'm sorry. Would you sit up for me a little bit?
I only need 3 toes. The other 2 I don't need.
Okay. We're going to listen to each section of the heart. So we're going to listen to the aortic, pulmonic, Erb's point, tricuspid, and the mitral valve. Okay, and make sure, okay, never mind. Okay, the aortic valve is right here. Listen to that. Okay, the pulmonic valve. Then we have Erb's point here. Then we have the tricuspid valve. And the mitral valve here. And sometimes you have to move the breast tissue just a little bit. And where the mitral valve is considered the apical pulse. If we were giving digoxin, we would have to take that for a full minute. Okay, now I'm going to listen to your lung sounds. Now, do you have any shortness of breath?
No.
Any recent cough?
Nope.
And you don't have any chest pain or anything?
No.
Okay. So we would listen to the lungs anteriorly and posteriorly. I can't even say those words. So let's do the back first. So I'll have you back me a little bit. Okay. And the left lobe has the left lung has 2 lobes and the right lung has 3. Okay, I'm going to have you breathe in and out for me. So we're going to start with the left upper lobe here. Okay, right upper lobe. And then we're going to move down from here, so we're going to inch down a little bit. Breathe in and out for me. And we're going to go to the left. Okay, and then I would just continue going down. And then I would also check her back at this time. So I would check for any pressure ulcers, any bruises, any abnormal skin discolorations, any of that. And it looks pretty good. So next I'm going to listen anteriorly. So it'd be just kind of the same process. So right upper lobe right here, breathe in and out for me. Good. Left upper lobe. Then we would inch down here. Then we would continue going down, and then we would end up at her sides here. So give me a good breath there. All right, sounds good. No crackles, no abnormal sounds. Okay, so now I'm going to have you lay down for me. We're going to check the lower body.
Okay, I can move my dog. There we go. Look at her, she just sit there.
So with the abdomen, I would ask, so I would inspect it first. make sure it's not distended. If she had a colostomy or an ileostomy or a peg tube, I would check those sites to make sure they're not infected. And then Ms. Haig, have you had any problems urinating? Have you had any changes in bowel function, diarrhea, vomiting, nausea of any kind?
Mm-mm.
No. And when you do urinate, is it clear? Is it dark?
It's clear.
Clear. Okay, good. All right, so I've inspected the abdomen. I've asked her about her urinary system. Now I will listen to her abdomen, the 4 quadrants going clockwise. So I'm going to start with the right lower quadrant here. And I'm going to lift up the shirt a little. And she said she did have a hysterectomy, so there is an expected scar right here. Okay. So that wouldn't be an abnormal finding. And if you don't hear anything, you're supposed to listen for 5 full minutes. Right upper quadrant. Okay, and left upper quadrant here. And left lower quadrant. And after I listen, I will percuss and palpate. And then I would ask her if she has any tenderness anywhere that I'm pushing, and just kind of feel around there. Okay, next I'm going to assess her legs. So, Ms. Haig, do you have any pain in your legs?
No.
Any numbness, tingling?
No.
No, okay. Do you feel me touch on both sides?
Yes.
Both the same?
Yes.
Okay. And can you act like you're pushing the gas with both feet for me? Point it towards the window, okay? And then do it towards my resistance. Good. Can you lift your right leg for me? And then don't let me push down? Okay, lift your left leg, don't let me push down. Good. Okay, so she is strong on both sides. She can lift against my resistance. And then next we're going to check cap refill, even though we've done it in the fingers. We also want to do it in the toes. So, okay, under 3 seconds, looks good. We would also look at the pulses. So we would feel bilaterally for the dorsalis pedis here. And those are 2+. And then we would do the posterior. And those are 2+ as well. And I don't notice any swelling, and no edema is noted. Looks like you're pretty healthy.
Oh, good. Good to know.
Yes, and so I encourage you to come in once a year for a checkup. If you need anything, and if the patient was in the hospital, I would give her call light to make sure that if she needed anything, she would be able to call and she'd be able to reach it. So, all right, thank you, Ms. Haig.
No, thank you.
Thank you very much.